Hello and welcome. I am Dr. Lara, a clinical pharmacist specializing in functional medicine, as well as a certified yoga teacher and Reiki master. I run a truly integrative health coaching practice encompassing functional medicine lab testing, yoga and meditation, and a sprinkling of Reiki energy medicine. Join me here on Light Body Radio to break through your health plateau and come into alignment with your natural vitality. Hello and welcome to the latest episode of Light Body Radio. I'm your host, Dr. Lara, and today I have with us again David Krantz, a certified coach specializing in genetics and epigenetics, nutritional genomics, and nutrigenetics. David has developed a proprietary genetic test for the endocannabinoid system. He has been a speaker at several biohacking conferences like Body Hacking Con, speaking alongside leaders like David Asprey and William Hoff. And David is currently an advisor to AMMA Healing as a specialist on the genetics of the endocannabinoid system, along with Dr. Dan Eagle from On It Labs and other leaders in, I would say, the optimization and personalization of medicine and healing. Wouldn't you say that? I would say that's
I'd say so.
Yeah. So today we want to pick David's brain about psychedelics and their role in healing and specifically in mental health treatment. So welcome back.
Thank you, Lara. It's great to be here again.
Cool. I think this is a really exciting field, and I know that it's just coming back into the forefront of both mental health and healthcare in general. So I just want to start with asking you your perspective of why this and why now.
Sure. That's a pretty multi-layered question, but I think there's two big factors in my mind around the resurgence of psychedelics. First is just the state of society we find ourselves in and the vast mental health crisis that, is upon us. And I say upon us because I feel like it's very much a collective issue. This is, when we talk about mental health, so often it's talking about individuals having mental health issues. And that's true, but it's a lot of these mental health issues in our society are coming from larger societal collective issues. I recently heard a psychotherapist I really respect talking about how we're not really treating individuals, we're treating Western civilization. We're treating the symptoms of Western civilization when we're talking about things like depression and anxiety. Mm-hmm. And so I think that in and of itself has, caused people to say, the tools that we have are not working well enough. So let's look at other options, almost out of a desperation. Mm-hmm. And then on the other side of things, I think you have the illegitimate legalization of these substances in the first place. When we look at the origins of the illegality of psychedelics and other psychoactive compounds, those things were in a lot of senses made illegal in the beginning because people didn't understand them. There was they were inherently threatening to Western culture to all of a sudden be allowing people and giving people the opportunity to experience themselves as something that is not found within the confines of Western, mm-hmm. thought. Like, these are the psychedelic experience itself is inherently opposed to the Western reductionist materialistic worldview that most of American and Western society is built on top of. Mm-hmm. So there's inherently a disconnect with the quality of the psychedelic experience and kind of the framework that we find ourselves in. And so I think that when you kind of zoom out and say, all right, why were these things illegal in the first place, despite, a rich history of indigenous use of historical use, and despite a pretty rich history in the 1930s to the 1950s, early 1960s of real, legitimate, solid research in the mental health field to begin with. So I think there's, from one angle, just the real need to have something different to, treat what's going on. And we can talk about the the subtleties of that a little bit more in terms of this kind of question of, is this a personal problem or is this a collective problem? Where do those things kind of, link up and meet? And then on the other side, just the lack of real solid grounding for why these things are illegal and taboo to work with and talk about in the first place.
Yeah, so let's start there, because let's just give people like maybe a brief background of historically how they were used in therapy before they were made like Schedule 1. And also too, I want to maybe ask you specifically if you're talking about specific substances or if we want to continue to talk about them as a generality. So, and I think getting specific is helpful, because things like ketamine are in terms of controlled substances with the DEA classification, that is, I believe, a Schedule 2, maybe even a 3. But like things like LSD, for example, are Schedule 1. So Schedule 1 means, for those of you that are unfamiliar, Schedule 1 means technically, per the DEA, no medical use whatsoever, which is also what cannabis is scheduled as currently, which is why we have this dance between states and the Fed with its now legalized use in some states. And then you have medical practitioners like myself who we're regulated by the Fed. And so there's this question of, well, is it legal for us to use them with our patients? Because the Fed gives me my license and they can say, no, there is no medical use for this, even though we know that's absolutely not true. And so let's take that into the context of these psychedelic substances.
Yeah, absolutely. So I think it is helpful to kind of break them apart and look at them individually, especially when you're talking about ketamine, because it is in its own class in a way as compared to the other more classical psychedelics, which, we're talking about with those, LSD, psilocybin, DMT, going to be kind of the main three that we're talking about. MDMA also kind of falls into that category, but it's also not really a classical psychedelic just in terms of the effects. And, in terms of things that are showing efficacy for different mental health conditions, pretty much all of those fall into that category in different ways. And like you're saying, ketamine is a anesthetic. It's been used as an anesthetic drug in surgery. It's actually the preferred anesthetic, but in the military, because of its fact acting use like on the battlefield as well. But it also has the psychoactive effects that create pretty intense experiences for people. And the ketamine experience is a little bit different than, say, LSD or psilocybin. But in terms of availability, ketamine, is available through legal prescribers right now for depression, especially. So we want to, highlight that and say there is some ability to utilize ketamine for depression and for other things, but there's been a long ongoing battle to get things like MDMA, things like psilocybin available in the commonly used treatment set. And also, there's a lot of research that still needs to be done to show what's the best way to use these things for whom and how. But then again, that fits within kind of the Western framework of doing medicine, of doing research. And I think, when we kind of break this apart, we do want to touch on that. Hey, that is only one way to use these substances. And there's, again, like I said, a pretty rich history of these things being used in ceremony and in things outside of the Western medical way of doing things that can benefit mental health. And so, it's kind of a tricky conversation, I feel like, to have. And I'll say, this is where my mind has been at a lot lately, of like thinking about, all right, we're essentially importing a set of compounds and substances into the Western framework that actually have some precedent in other frameworks. And so there's a big dialogue right now within, the communities that are bringing psychedelics into medicine. Like, all right, what can we learn from indigenous use of these things? How can we actually, build a bridge to these other ways of using these things, rather than assuming the Western psychological framework is the only one that works when we're talking about this? So I feel like that kind of jumped off from the initial question there, but I'm wondering if
totally cool. So just for clarification's sake, for all those out there that are now wondering, like, where are we within this spectrum of the DEA? And, so ketamine is a Schedule 3. meaning it does have what they consider like a medical use, which we already knew. And now we are branching it into the mental health field. So branching it out from only anesthetic to now some psychological therapy uses. And then like we just explained Schedule 1, which is the very extreme of restrictions. And so, yeah.
Yeah, so the Schedule 1 drugs are the no medical use, and they're illegal, which, of course, it's absurd that cannabis is still Schedule 1.
Yes.
And, psychedelics were not illegal substances until 1968. And so I think that's important to consider just in terms of the overall history, that when these things were being studied in the 1950s, and there was a really big interest in, especially LSD, in the 1950s in psychiatry, looking at it for a variety of different purposes, treating alcoholism, depression, all kinds of things. And there were a lot of really positive results from that. Now, a lot of them were not as, say, well-controlled and well-designed as you'd want in a study going on now. Mm-hmm. So that's oftentimes, I would say, more of an excuse than anything to say, like, oh, no, there's really not enough evidence to show these things are helpful.
So I guess my next question is, like, what's the difference between when they were first used on a, quote, we'll call it regular basis in the research field, like back in the 50s and, even earlier than that, really, and versus now. So we've sort of had this hiatus of absolute prohibition, and now we're opening up our minds and the possibilities. And now we are having to lobby the DEA to reconsider for a variety of things like cannabis, like LSD. Peyote, for example, is on the Schedule 1 list. MDMA, ecstasy, all of those are on the Schedule 1 list. And I think people need to also keep in mind, and I think this is worth saying, the DEA created their scheduling and assigns the scheduling, especially in Schedule 1, based on potential and actual abuse in sort of the subculture in the underground world. And so that's definitely a factor of why they did and do what they do. But there is definitely this conversation within multiple areas of the medical field and the DEA of, okay, well, can there be a happy medium? Can we deschedule things to like maybe Schedule 2, which requires, a certain level of prescriptive authority and monitoring and oversight, but is allowed to be, at least because with Schedule 1, you're not even allowed to technically study it for a medical use. And I think that's where this conversation too is sort of happening. Like, okay, well, we know that there are medical uses, so let's stop being so prohibitive and let's allow it to at least be studied, so then we can include it more in medical studies and medical treatment and really start to understand it better, instead of saying, well, it's abused on the black market, so let's just say no. Yeah.
Right, exactly. And the scheduling, it's a conversation between the DEA and the FDA, which is going to, the FDA is going to be the ones deciding, okay, there is a quote unquote legitimate medical use for this. And then that inherently changes the way that the DEA is going to schedule them and enforce it. And, right now, MDMA especially is pretty close to that designation of the results from the phase 3 trials, which, there's 3 phases of clinical trials that something has to go through. MDMA is currently completing its 3rd phase for PTSD, and again, showed pretty dramatic results. I think the most recent published results are something like 70% of the participants no longer qualified for PTSD diagnosis after a couple months. And it's leagues ahead of comparable treatments, right? So this has caused the FDA to grant MDMA a breakthrough therapy designation, which means it's getting moved through the processes faster than it typically would be without that. And there was recently a head-to-head trial of psilocybin for depression versus citalopram, one of the commonly used SSRIs, and found that psilocybin is equal or better in effectiveness versus that. So that's a pretty big study that just happened as well. We're in this kind of interesting transition phase where there's enough very promising studies on a variety of different psychedelics, ranging from from MDMA to ketamine to LSD. Well, LSD isn't so much in the picture yet because of the stigma. A lot of people are focusing more on psilocybin because it doesn't carry the cultural stigma of LSD. It's easier to research. And like you were saying, having these things as a Schedule I substance makes it so it's very difficult to study. You have to get special approval. You have to jump through every hoop there is. Mm-hmm. But people are doing it. And there is, for anyone who's not familiar with the organization MAPS, the Multidisciplinary Association of Psychedelic Studies, they've really been the ones since the 1980s pushing for this. And they have self-funded all of these MDMA trials. So they're definitely to thank in terms of a lot of the resurgence of this, a lot of persistence, a lot of not taking no for an answer. And I'll link this back to your question around, okay, how are these things actually being used? Like, before they were made illegal or even in the underground, there was a lot of therapists that were using MDMA, especially in the 80s. And I believe it was banned in the mid or late 80s. But before that, and when it was a legal substance, people were saying, hey, this helps people open up. This helps people really be vulnerable. It helps people communicate in a way that they wouldn't ordinarily be able to, which is very therapeutic. That is one of the core healing values of therapy itself, is to be able to express things that have felt unexpressible or difficult or dangerous. And MDMA tends to turn down the amygdala, the emotional fear response in the brain, in a way that allows difficult, painful things to be talked about in a way that's not so charged or not so difficult or intimidating to work with. And, so there's a lot of what's happening now in the field is proving things that people kind of already know, you kind of have but having to do it in a rigorous, controlled way, which is good.
We're giving it that quote official validity instead of just the quote anecdotal.
Right. Instead of the anecdotal, understanding some of the neurological mechanisms and things like that as well, But I think it's also important to note here that a lot of what's being studied is not just the psychedelic, it's the psychedelic plus therapy.
Right. So that was my next question. Yeah. So let's talk about where it is in its place in therapy, because I think it's important to say exactly what you just did. It's not the only tool being used, that if it's being used at all, it is within an ensemble of other aspects of treatment modalities. So let's talk about what that would actually look like in, let's say you were going through treatment for PTSD or even major depressive disorder or any of those where these come into that realm of treatment.
Yeah, absolutely. So, in terms of the way most of the modern studies have been designed, they're looking at psychedelics in the context of them being used as a therapy tool. So it's not just people going and eating mushrooms for, hanging out for 6 hours and then that's it. There's a preparation process, doing therapy sessions, talking about what, you want to get out of these experiences, what has led you to this point, and really developing a therapeutic relationship with a therapist, to be able to develop trust and have a safe container to do these substances in, because they heighten things. One of the kind of the godfathers of psychedelic therapy, Stanislav Grof, who did several thousand LSD sessions in the 50s, describes psychedelics as a non-specific amplifier of psychological processes. So what that means is they really just bring up whatever is underneath the surface, whatever is underlying the depression, whatever is underlying the anxiety. It's those deeper currents of the psyche that psychedelics tend to expose and bring up and allow to be in contact with. And the preparation process sort of gives people a way to start to touch into those things before it's just out of nowhere, right? It's you want to have a little bit of...
Yeah, so I think it forces the patient to get specific, be intentional, create the safe space with their therapist and within themselves. Because like you said, when you are in an altered state, these things come up whether you want them to or not. But when you can set the intention to, yes, I want this to be the focus. That's how our brains work anyway. It's like, okay, we're pre-paving this way of, I know I'm going to examine this. I know that in the past, either it's been traumatic or all of the levels of what we would consider, quote, negative emotions or less than high vibing. And now we're creating this space where I am willingly looking at it, examining it, and getting curious. And then also, I think opening up to an alternative perspective and reaction, and having a guide there to sort of like, if things start to go wonky, or maybe like I start to feel anxious as this, whatever it is, scenario is coming back up in my memory field, then the person is there to help guide or, do work their, master trained therapeutic magic, so to speak. Does that sound?
Yeah, absolutely.
Sorry, I didn't answer the question.
Yeah, no, I think that's spot on. And it's very much in alignment. There's an article published last year by Rosalind Watts, who's one of the lead investigators on the psilocybin studies for depression in the UK. She's at Imperial College of London. And maybe we can link this in the notes for anyone who's interested, because it's one of the best papers I found from a therapist perspective of like, how would you actually approach, what's the content that's coming up for people in a session. And she has this model that they call the ACE model, the accept, connect, embody model.
Okay.
And it's exactly that in terms of working with whatever happens in that session. It's like, how do you accept what's here? How do you say, all right, this is what's happening for me right now in this moment? How do you connect more deeply with that, with your experience? How do you stay with it? How do you breathe through it? How do you, not turn away from the difficult material and treat this experience as an opportunity to, like you said, be curious about it? And then how do you embody it? How do you, relate to the physical somatic sensations in your body and allow those to be there and use that as a way to move through whatever the things that have not been able to be worked through yet. And that, I think that for any practitioner who's interested in working with this or thinking about it, like her that paper is just amazing. But it just reminded me of that a lot. And so, yeah, that, the preparation process is starting to talk about, all right, what kind of framework are we going to bring into the psychedelic experience? How are you going to relate to what shows up? And just, yeah, like you said, start to almost practice a little bit, thinking about that.
Yeah. So if from that perspective, is there one better than another for examining certain aspects? So like my background is in pharmacy, pharmaceuticals, very familiar with SSRIs and all of that stuff, for better and for worse, because they are not benign substances by any means. But when we are examining even, down to the bioindividuality of neurotransmitters, we can get specific with these medical substances that are currently used. So can we do that with the psychedelics as well and say, okay, for traumatic experiences, we like to use this one because of its action. For major depressive or anxiety, we like to use this one over here. Have you noticed that evolving in the field, or are we still at the early stages and figuring that out?
I'd say we're still pretty much at the early stages of figuring that out. There's definitely some things that you might lean more towards one or the other, especially depending on kind of what stage someone is at in healing. Thinking about something like MDMA, which tends to be less like re-traumatizing, tends to be more suitable for working through like severe active trauma. Just in terms, like I was saying before, it tends to downregulate the fear response in the body. Certainly something like psilocybin might do that, but there tends to be more of probably a better sequence would be for someone to get out of that active trauma first and then maybe do some psilocybin work after that.
Okay.
And same thing with ketamine, it's definitely better for, say, depression than, like personality disorders, something like there's aspects of that, and probably better for depression than anxiety as well. But I think that's kind of an unknown at this point of like, what not only what substance is going to be effective for what, but also what type of therapy, what type of setting, what type of preparation and integration is going to work best for something specific. And, I think the other thing too is like, it's pretty important when talking about symptomology, to not necessarily relate to those symptoms as the same thing as the cause, and really think about like, is depression fundamentally related to someone not getting their needs met in a specific way and not being able to feel confident asking for what they need in life, and like that type of depression could be very well suited to something like psilocybin that might enrich meaning in life or allow someone to feel more connected, versus something like ketamine where, maybe that is someone experiencing more of a physiological type depression where it's more, biochemical in nature. Who knows? There's like those subtleties I think are yet to be really parsed out.
Yeah. So my next question, just while we're in this framework of thinking about it, because then I do want to take it into some different perspectives also. So microdosing. So where does that, because I know microdosing has come into the field of conversation with various things, and especially in the biohacking world. And so is that an aspect of this approach, or is microdosing more what someone would use on their own personal level without a therapist?
Yeah, microdosing is kind of off in its own world a little bit in terms of that. Tends to be more off-label, people doing it on their own. With ketamine, though, there is like the prescription nasal spray that some people use as a microdosing kind of thing, which does tend to be effective as well. And I think that's just one of those things that a lot of people report good results from. It's pretty arguable whether it's placebo or not. But again, in my book, if you can leverage the placebo to work for you, it's just as effective as whatever else. So
yes. I'm a big fan of actually the positive effects of placebo effect.
Yeah, absolutely. I mean, I'll say for myself personally, I do find, a little bit of microdosing can be useful for certain types of thinking, certain types of just being, really. But I don't think there's a clear directive on really how to do it. I think there's a lot of people that want you to think that there is like a clear way to do microdosing so they can sell the programs and sell the little things about it. But I think the actual science on it and the actual experience is like, or there's a lot of unknowns. And I think the potentials for things to go wrong is like a lot lower than doing macrodosing. And again, there's, so in terms of kind of dipping your toe in the water a little bit might be better for some people, but also like can't really expect the same effects and results from a microdose versus a full-on dose, because microdoses don't really create that same type of threshold experience where
Yeah, and I think the goal approaching the two are different, and I think that's worth noting too. So if you would be using let's just call them like full therapeutic doses, then you, again, like this is not something you're doing on your own. You're doing it with a guided therapist in some way, shape, or form. But if you're microdosing, then maybe you are sort of figuring out what that magical balance point is for you in terms of creativity, productivity, functioning in a different way in the everyday world. Like you're not taking yourself out or into a different consciousness state, so to speak. And so and this brings me to, because you are an epigenetic specialist, so have you seen like epigenetically and maybe even like down to the nitty-gritty of some of the testing that we like to do as these precision therapy health coaches. Have you seen those? I know you've developed the test for the endocannabinoid system, but have you seen it also in the effects with different psychedelics and, that type of personalization?
Yeah, talking about like nutrigenomics of psychedelics.
Yeah, kind of. Yes, exactly.
Yeah, there's a little bit of preliminary stuff, but not enough to make it really worthwhile or useful yet. I think that'll change. I think our ability to predict response is going to grow. In terms of utility, it's not quite there yet. But I definitely think that is going to be on the table here in terms of just being able to better predict, what someone is going to respond well to, what dosage, what way to use it for different people. But in terms of the state of the field right now, it would be tenuous to say that like that's that's available and really worthwhile at this point.
Yeah. So also too, have you seen like sort of like group therapies offering this, or are you seeing it mainly just in the individual realm? You talked a little bit about before, especially with our cultural, I feel like really sort of when I think we're all processing cultural trauma now. I think we've been doing it for a while, but I think it's at the forefront now. And so I guess that's my question is like, especially if you get a group of people together that are working through like the same general issue, could you almost do this in sort of like a guided retreat situation where it's focused around one big intention and sort of cultivated from there?
I think that's a really beautiful question. And I'll say a lot of the psychedelic and entheogenic work that's been done historically, outside of the kind of little blip in the timeline of it being now like, well, let's approve it for medical use in the system. A lot of that has been done communally. A lot of ceremonies are done as part of a group ritual, as part of something that's embedded within a culture. And so I think there's tremendous utility there. I feel like it's not something that's well understood in terms of from the like peer-reviewed Western perspective of how to do that well. There's one study that I'm aware of that's looked at a group model, and it was for older men with AIDS treating depression and demoralization. The study came out earlier this year from a group in California, and showed pretty positive results doing group therapy and psilocybin sessions. The psilocybin sessions themselves were individual, but the pre and post work was done in a group therapy setting. And that's something I'm personally very interested in as well, especially when you look at it from the lens of how psychedelics tend to influence nature relatedness and being aware of like more ecologically aware. And I know this is kind of a jump off into the other direction, but I'll leave it back here in a second. So if we're like, here's my framework I'm coming from. Like if we really break down what is the mess that we've gotten into ourselves into as a species, what are the things that is really contributing to the mental health crisis on a deep sociocultural, call it even soul level type stuff. The view that humans are not part of nature and that nature is something separate and something different characterizes Western society in a way that is absolutely unique from the rest of human history. Like throughout the rest of human history until the last, really couple hundred years, 1,000 years in this, tiny subsection of human thought, like we have been integrated and a part of these cycles, a part of the land, a part of that. And we're in a crisis now of disconnection with nature. Like any way you cut it, you look at the climate crisis, you look at the crisis of poverty and famine and things like that. It's an ecological problem. All of these things are stemming from ecological issues in the way that humans relate to the earth we live on. And there is a pretty profound ability of the psychedelic experience, and this is well researched, to increase a sense of what that psychological construct is called nature relatedness, which measures basically how much do you consider yourself to be a part of nature, how much do you consider yourself to be nature itself. And psychedelics tend to reliably increase that, especially when there's nature contact, especially when you're around the woods. And from the perspective of like, what can we do to fundamentally change this in a long-term sense? I mean, my view really is that if we need to change our relationship to what we perceive as natural and what we perceive as unnatural, and really just get rid of that distinction altogether. And psychedelics have, the ability to blur those boundaries in a felt subjective sense that is more akin to the way that indigenous animist cultures would have felt the way we're in relationship with the earth and with each other. And they're not being so much of these distinctions that characterize, the modern Western mindset. And so I think from a group ecotherapy perspective, like getting in touch with not just our relationships to our deeper selves, but, and I say self with a capital S, like not just our individual ego, but consciousness itself. What does that mean how does that relate to psychedelic experiences that are healing, right? Like the healing aspect of itself often is what they call the mystical type experience, or the sense of being interconnected with all these other aspects of consciousness, and the breaking down of where we begin and end seems to have a therapeutic value. And so if we're looking at just, I don't know, long-term trajectory in human history, I feel like the best thing we can possibly do is create experiences where it is more apparent that we are in relationship with the earth. We're in relationship with things that are other than human in a way that is not present in culture.
Or is maybe just having a regenesis.
Yeah, a remembering. Right.
Yeah. Well, and I think actually, again, I tend to talk about the silver linings of COVID quite a bit. And I think this was one of them, is that although there was the stress and sort of the insult of the isolationism that COVID brought on, there was also this push and draw to get back outside in nature. Okay, so I need to, for a lot of us that exercise on a regular basis, okay, how am I going to do that? Okay, well, I need to find a way that I can do that not around people. But also too, I think just people that wouldn't normally, quote, feel the need to go outside when they were forced to be inside. Now they're like, oh no, I don't want to be stuck inside. I want to be outside more intentionally. And so, yes, I definitely agree with you. There is, for some of us like you and I that live close to nature, it's a lot easier. But I think it's also a choice, and it needs to be intentional, because even if you live in a big city like New York, there are ways to get outside and be in touch with nature. And then you have to maybe make a little bit more of a concerted effort to get out of the city more often, or whatever your choices are going to be. But it is a choice. But I think, like you said, like culturally, we've gotten so disconnected, I think, and especially if you weren't raised in nature or the woods or by natural, less concrete, or more concrete jungle, less nature, so to speak, then it's not as intuitive for some as it is for others. So yeah, for sure. I definitely agree with you.
Yeah, I would agree with that. And I will also challenge you a little bit on the frame there, in terms of just even describing like either you're near nature or you're in a big city. My point is both of those are nature. Both of those are, there's no distinction. And the more we continue to say these things that we've built are not part of nature, the more it furthers that separation and creates a human world and a nature world. And the more the more that we're able to break that down, the better. And it's painful. It's really painful to acknowledge that this is what we've done. This is where we're at. The cities and the highways and the electrical lines, like we have put that here. And now that's part of this thing that we call nature, even though we don't,
even though it's man-made. So yeah, I think I think that's a great distinction, because from my perspective, I was thinking like literally from the earth, and we are from the earth, and we made these. So yeah, I can see absolutely. I like that.
And there's I think a grieving process that we are constantly fending off just by virtue of having to survive this thing that we've created. Like it's incredibly.
I think we're taught to not to grieve. I think that's definitely something cultural that I've seen, and I work with my clients a lot too, is that giving yourself the space to have all the feelings. And that's why I sort of cringed earlier when I even used the phrase negative emotions, because I now am of the perspective, none of them are negative. They're just all different. And we need to create the space for it to be okay to feel the feelings, no matter what the feeling is, because when we feel it and we process it, then we can move on into our next glorious ensemble of feelings. And, that doesn't mean like, I think we've been taught that, you push down, you push out, you suppress all these things, and that somehow prevents something. But then really all it does is create these not good feeling mental states. And then that generally escalate into a full on something that we don't know how to get out of, that we need a therapist help with. And so, yes, like, so talk about like cultural ingrainment of, of even how we like deal with grief, sadness, fear, depression, and anxiety, which are also just like we've given them clinical diagnoses, but they're really just feelings and they should just be temporary.
Yeah. And they're signposts and indicators to pay attention to. And when we resist those indicators, it's like body's just going to keep showing them to you again and again. And then that shows up as anxiety or depression or whatever. And I think that what you're describing, that ability to really stay with and honor the full range of those things, is a lot of the core of a lot of work that happens on psychedelics. Is like there's something about the psychedelic state and experience itself that makes it easier to accept and be with those things. Like it's almost like a supercharged couple hours of being able to just be there with that stuff that normally is too much. And it kind of expands the capacity to do that. And I mean, really, like there's a sense of a much larger force that can hold that, that not just you, it's not just you, holding that. There's a sense of larger love or something that tends to make it easier.
You feel connected, you feel cradled, all those things, whether it, ideal, like, yes, by nature, whatever that means to you. And I think also too, it's funny, like when I think sometimes too, if like you choose a psychedelic experience, then you automatically are in this mindset, this is only temporary. So all I have to do is breathe through it and it'll pass. But it's the same concept, even if you weren't in your altered state of consciousness, even, so anything.
Right. It's the amplifier.
Yeah, exactly. Anything that's uncomfortable in your life, all you have to do is breathe through it and it'll pass. Everything. That's the most constant thing in this realm, is things that are being temporary, is change. So yeah, it's really interesting. Okay. So action steps or suggestions, tools, what do our listeners get today?
Yeah, it's a good question. I mean, I think, the question that comes up is always, well, where can I go do these? Mm-hmm. How can I get them? And I'll speak from my perspective as someone who's just kind of been a psychonaut for a long time, someone who likes to explore my own consciousness. I would recommend doing it in a legal setting if you can. And yet at the same time, there's a part of me that says, if you do your research, find the right person to do it with, just be careful.
Yeah. So I think it's worth stating, like we've talked a little bit about the indigenous cultural background and history. So there is the entire realm out there of shaman mediated healing. And I think there are substances within that realm based on the specific culture and retreat aspects. So that's there for people to research. And then there's also then the sort of the Western side of things with finding a therapist that you can do this work with. So it's all there. Yeah. What would you like to say to that?
Yeah. I would say just do your research.
Yeah.
Don't rush into something because it seems, like a good idea unless you know who's facilitating and you've got some recommendations. And there's a book called the Psychedelic Explorer's Guide or Handbook, Psychedelic Explorer's Guide, that is really worthwhile just in terms of thinking about what you would want out of an experience, and gives a lot of considerations for finding a sitter or a guide, or just thinking about how to set up an experience that's going to be beneficial and helpful and ultimately not harmful, right?
Right.
And I'll say that the risks are fairly low, but they're there, especially if you do have something like bipolar or psychosis or something that might get triggered, PTSD included. You want to be pretty careful if you have like active issues going on,
and or fresh trauma of any kind.
Especially. So don't go rushing out to do them just because you heard it might help you feel better. I'd say really do research, and if you do decide to do them, listen to the voices of people that have done them many times before. And there are good resources out there in terms of thinking about how and when, and having a therapist to do integration, preparation integration with can be very helpful too, if you're really serious about like wanting to use them for some type of healing purpose. Like I would strongly recommend, because, a therapist can help you with that. They might not legally be able to help you with the experience, but they can help you prepare and integrate. And that's really essential in getting the most out of it and doing it in a safe way.
Yeah. Help giving you structure to the process. Yeah, I like that. So what about just reconnecting with nature and reframing our thoughts about nature? Do you have any suggestions for that?
Yeah, that's very much been part of my own practice the past, really last year and a half, longer than that, but I think more intentionally recently. Like I'll point anyone who's really interested in that to someone named Daniel Foor's work, Foor, really coming at Western psychology with an animist framework, like looking at how do we integrate what humans have known for millennia, that the world is alive and we can have relationships with the land and we can have relationships with the trees and all of that. Like, he has some of the most approachable work I've seen from like for a Western mind. Like he's just packaged things really well, and he's an initiate of a number of different traditions. And I'd say to look at his work if you're really interested in that. And I'd say it's not an intellectual thing; it's an experiential thing. It's the process of going out every day and saying hi to the birds, and experiencing what that's like. The quality of being in relationship with other than humans is what I'll say. I think it's thinking about things relationally. Like, am I giving energy and attention to this relationship or am I not? And the default mode is to not. So it's a process of cultivating relationship in whatever way makes sense for wherever you are, and if you're in the city, that might mean, being in a relationship with the clouds or the sky or the few trees that are growing there, but it's still able to like access the macrocosm through those little individual small pieces of it.
Yes, absolutely. Yeah, I think, and also too, just having that really easy and simple willingness and curiosity and to try different things. What's, like breathing with the trees, which could be anywhere from like sitting down at the trunk with your back, or even like just putting your hands on a tree trunk and closing your eyes and just taking some deep breaths. To full on, going swimming, like really trying on maybe even all the 4 elements and just getting in tune with your perception of being around them, and then being open maybe and curious about, okay, well, what could I be open to receiving from these elements? Because I think that to me, we're talking about like really like setting the foundation for the basics to someone that does feel totally disconnected or just not like raised in the practice of being in and of nature. So like you said, like you challenged me, you're like, but I would argue that the city is part of nature. And so like really, okay, then what does it mean to be in tune and connected with that, instead of I'm a singular alone person in the middle of the swirling chaos of the city? So you're like, what is that difference? And just start to get curious and maybe journal or, meditate, or, there's so many different tools and things and ways to approach it out there, and really just figure out what works for you and keep moving and growing from there.
Yeah, absolutely. I really like that. It's the process of just being curious and saying, all right, what happens if I do an experiment and today I give myself the opportunity to be in relationship with my surroundings differently. And it's that frame shift. It's that different attention, different type of attention.
Yeah.
And like, it's funny that we ended up talking about this because we started talking about psychedelics, but I feel like this is the natural extension of experiences that lead to more connectedness. That's one of the big themes across the board from psychedelic experiences, is people feel like they're more connected, whether it's with themselves or with the human species as a whole, or with nature, or with the cosmos, whatever it is. There tends to be a sense of, oh, I'm not as alone as I thought I was. And my sense of isolation is actually more of an illusion than a reality. And so maybe to just kind of close it out here, like the purpose of that integration, the sessions after the psychedelic experience, is to take whatever happened in that psychedelic experience and ground it into daily life and actually say, all right, how do we take whatever it was that happened during this moment and translate that into a different way of being? And that sense of being in relationship with the other than humans is like a core fundamental thing that tends to happen through psychedelics. So that's something that you can cultivate without psychedelics as well. So I feel like that's where the conversation has naturally been going for me, because that's been part of my own practice with or without psychedelics. It's something that's enriching and important, I think, on its own, but that also synthesizes and mixes well, plays well with the psychedelics too.
Yes. Absolutely. Okay, so we're going to make sure to include a fantastic list of resources in the show notes of both the study that David was a co-author of, and then anything else that he has suggested. I'm happy to include. And thank you so much, David. And is there anything else you have a burning desire that we haven't talked about yet?
Ooh, I don't think so. No, this is great. Thanks for letting me talk about nature and what I think about it.
I'm a huge fan of nature, and I think it's also part of our core beingness that we need to reconnect and cultivate more. And again, with that intentionality and curiosity. So I'm right there with you. Absolutely.
Yeah, absolutely. And maybe we'll link this in the show notes too. There's a researcher named Sam Gandy who's been tracking this link between nature relatedness and psychedelics, and so leave that as a breadcrumb for some people. I have a feeling you really like some of his work too.
Cool. Yeah. I always love exploring what you send me to for our show notes. So yeah. Awesome. Well, thank you again. And I'm sure we will have you back, because I already have a list of things I want to pick your brain about. And so, but we only have so much time today. So thank you so much.
Yeah, you're welcome. It was a pleasure.